And the next thing we observe, that is the muscle wasting. So a muscle start wasted out. This is because of disused, when the person do not use his or her muscle. And the next thing is their nerve entrapment or nerve cut, that is the nerve supplying the muscle is cut off, maybe due to any injury or any kind of accident. Okay. And the third thing is the inflammation of the associated structure may cause to develop wasting of the muscle. This is because when this is inflammation occur in the associated structure, that is inflammation occurring close to the joint and the inflammatory cell, and there are a lot of the cytokine. These cytokine stimulate the receptor that is caused to wasting of the muscle. That is, they activate those kind of the protein, that these protein or these enzymes start degrading the muscle. Okay. So the inflammation cause muscle wasting. And the next thing we observe is the palpation of the joint. So you have to palpate the joint, and when you palpate the joint, you observe the patient face, that which kind of expression they give, and you should be gentle. Okay. And palpation point is that where the tenderness is least, where the least tender is present, and tender is the sensitivity to the pain. Okay. And you observe when you so here we take an example. This is the proximal interphalangeal joint. Peep, or if there is this is the affected joint. When the physician feel the or physician palpate the joint, then they feel the warmth or the temperature increase in this area, not on these area. Okay. The temperature of these areas are normal, but the temperature of PIP joint or the surface covering the PIP joint is increased. Okay. So temperature is increased, and when the temperature is increased, it indicates that there is some kind of inflammation. Okay. So and inflammation may be occur in any kind of joint diseases such as rheumatoid arthritis, osteoarthritis, gout. Okay. And the next thing you observe is the tenderness. Okay. So tenderness is actually the sensitivity to pain, that patient become more sensitive to the pain. Okay. Tenderness have 4 grades, so you have to put concentration. That the first grade is that when you palpate, when the physician palpate the joint, then the patient feel pain. Okay. So they told them that they feeling pain. Okay. In that is pain on palpation. The first grade is pain on palpation. The next grade is pain on palpation plus winces. Its mean winces is actually a jerky movement or a shrinking movement. Okay. When you palpate the patient joint, then they feel pain and they wince like that. So this is jerky movement. When you palpate the joint, this patient start move like that. And in grade, this is grade 1, 2, 3 and 4, and grade 2 contain pain on palpation plus winces and plus withdraw the affected limb or the affected joint. So here when the physician touch the patient or palpate the affected joint, then the patient feel pain, winces and withdraw. Okay. So feel pain, winces and withdraw. Okay. And the fourth grade, the patient do not allow the physician to palpate the affected area. Okay. Do not allow to palpate. And the next thing you observe is the swelling. In palpation, you observe the swelling. If the swelling is like a soft, spongy swelling, it's mean that there is a synovitis. It's mean that the synovial cell may involve, synovial membrane may involve, the hypertrophy of the synovial cell may occur, and the swelling may be of soft fluctuant swelling. It's mean fluctuant mean a wavy movement or a wave like movement of the fluid inside the affected joint. So here is so if we take an example, so this is a joint, okay, and we, so this is the joint and we palpate them, and here another finger is here, okay, and so this, and we, when we touch the third finger in between these two finger, then we feel that the fluid move uh, up and down, or the fluid move forth and back, okay. So this is the, when you feel like that, it's mean that there is a fluctuant swelling, or this indicate that any kind of effusion in the joint. And you observe the swelling when you palpate the patient joint, then you observe a swelling that is very hard, and this is very tough. It's mean that there is a osteophyte formation. So here is a osteophyte formation, or maybe a bone, subchondral bone is increased. Mass of subchondral bone increase. This is cartilage, and below the cartilage, so this bony area is called subchondral bone. And the last thing you observe is the passive movement. You perform the patient movement, which may be a passive, that is performed by the patient own self, or the active movement, sorry, passive movement, it is performed by the physician or the therapist, and the active movement is performed by the patient, okay. Then the next thing is that limitation of passive movement. If you move the joint, if the physician move the joint, or the movement is restricted or limited, okay, it's mean that there is any kind of disease or abnormality in the joint, okay. And we mostly use the passive movement as a diagnostic feature when we have to observe the restriction of the joint, okay, not the active movement. Then the next thing is observe that the movement is attempted. You movement must be attempted by a gentle, in a gentle manner, okay. Okay, and you observe that in this, when you ask the patient to move her limb, then there any kind of, there are two kinds of the condition may occur, that is the fixed flexion deformity and fixed extension deformity. Okay, fixed flexion deformity mean that the patient posture is fixed in flexion, okay, and the extension do not allow. And in fixed extension deformity, the patient posture developed in flexion state, okay, and the in extension state and the flexion do not allow, okay. Instability of the joint, you check the instability of the joint by passive movement. When the joint is unstable, it's mean that there is weakening of ligament, or a surrounding tissue, or tearing of the muscle or a tendon, okay. And the last thing you observe is the joint crepitus, is mean that is the cracking or a popping sound in joint. It's indicate that there is a synovial fluid decrease in the joint, and the air is increased in the joint, so this cause the popping sound, okay. So all of these things you observe in the joint examination. If you have any query, any question, then you can ask me. Thank you.